You have to have levels of accomplishment and achievements, and it just kind of motivates, and climbing leaderboards and competition with your friends and colleagues and family members. So our platform allows us to have challenges within organizations, and across communities, people are competing with each other. So it's really, goes back to dopamine.
Zach, how are
Hey,
you?
Slim. What up? How's it going?
Another day. It's good, man. Another day in the life, right? It's for the purpose of time. Today's the day. 757 TechNite. We'll kick that off here in 7 hours. So super excited about that. Two big events in a short period of time, but it'll be fun.
I hadn't put a clock behind it, but now that I looked, I was like, oh, it is only 7 hours away. Should be a good time. Should be a good show. Looking forward to seeing it. I have no involvement, so I'm excited that I can just be a spectator.
Well,
at least that's what we're telling everyone.
I mean, there's
be careful. Maybe there's a secret coming out. Maybe I'm going to do something.
It's
jean jacket. Oh, I gotta bring my jean jacket.
It is jean jacket weather.
I'm not checking no coat. It's gonna be hot in there.
No, it'll be fun. It'll be long time in the making. And
I believe the last. So, like, when I saw someone posted something about like it being a decade, 14 years ago, something like that, I believe. Now, I can't remember what the actual name of the award was, and it would take some digging. But I believe I was nominated for like whatever the big award was.
Oh, yeah?
Back then. I don't feel like it was Entrepreneur of the Year. I feel like it was something else. I could be wrong. Maybe it was. And I remember I did not win. And Joel Need, whose child was a part of I think he was part of Kempsville with that interview.
Oh, yeah. Yeah, that was a wild show. In terms of shows that we've
like
had.
19 guests. Yeah.
that was a fun one.
Joel Need won that night. That was just getting started with like Start Norfolk. I think we had done 2 of those. I think we were just starting Hatch. But yeah, that was like 2011, 2012. Yeah. Did not take home the title that night. It's okay. I might have been mad that evening. But
well, sold out show tonight, right?
Very cool.
It's nice when you can add that little moniker that it's sold out. And
well, congratulations to you, sir.
Well, it's not just me by any stretch.
I know there's a committee and all this stuff, and one of the people being nominated, or one of the companies being nominated tonight, someone that we met many times ago, but was on stage at the Cup a couple months ago, which seems like it was yesterday, but really I think it was like 50 days ago, which is crazy.
It wasn't long.
We got Mr. Robert Herjavec himself from Shark Tank. I mean,
I thought
I was thinking about opening the show that way. Like, man, 282 episodes we've been trying to get a shark on the show. We finally did it.
We should have held out for April Fools for you, Mr. Tom Chamberlain of EdLogics, not Robert, the cybersecurity guy on the end, who's.
That would be nice, though.
Yeah, I think he's speaking at the Cup, the grand finale over in San Francisco. Next week, where Neil Piper of Luminoa will take home the championship title.
Neil's awesome.
Yeah, we're excited.
All 10 of you. It was a really of all the feedback that we received, overwhelmingly popular piece of feedback was like, man, those are 10 really, really amazing companies. So kudos to you.
Thank you. Yeah, just being on stage, we won. Kind of like tonight, right?
Well, yeah, and there's like you said, it's a sold out show, and there's a lot of attention on this, just as there was with the World Cup. So that's what it's about. It's bringing the awareness to the companies and founders and the things that are happening here.
Yeah, appreciate you guys giving us the opportunity to kind of tell our story, and from today to the Startup World Cup and tonight at the 757 Tech Night. Really good stuff you guys are doing.
Well, thank you. What category are you nominated for? Is that emerging company?
Emerging Company Award.
Okay.
3 other great companies. So it's stiff competition, but like I said, everyone there is a winner.
Well, and that's what, I was wondering, like, just going back to the World Cup real quick, how did you feel going into it? Do they a lot of people are like really confident. Then when they saw the other 9 companies, they're like, man, this is a little tougher than I thought it was going to be. What was your feeling going into the World Cup?
I felt really good, because of what we're doing in health literacy. It applies to everyone in that room. And, but I knew there were some great companies. I checked them out, and I was just happy to be supported. They're all great people, great leaders. So felt really like part of almost a rock star team going into it. And felt that I was glad that I got a question. There were only a couple of questions, so that was kind of cool. But Luminoa is a great story, a great company, and he'll do well in the nationals, I'm sure.
Yeah.
But it was a good night. You guys did a great job, and lots of good feedback. That was almost a sellout crowd. That was a sellout crowd. That was huge.
Well, going into it, the whole goal was if we can fill that bottom bowl, then that is the goal. And then if we end up with 742, so mission accomplished was with that. And
I put on a bunch of parties before, and I feel like that was like the biggest one, right? I feel like Start Norfolk 3, I think there's 450 people at it, something like that. Like, it's hard to get that many people in a room. Like, you got to have the right thing that people want to be at.
And no one knew about the surprises, had they known, who knows what that number could have been.
Right. And you had Secretary Segura there speaking.
Yeah, Tom's brother. Yep.
Yeah. So, yeah.
Yeah.
But looking forward to tonight. That's going to be a great show. We've got a lot of good people in the community that are attending. So highlighting all the innovation going on in Hampton Roads. You guys are really key to that.
Is there an after party that we need to know about? I heard there was an after party after the World Cup.
We did. We went over to Twist after that. It was great. But nothing planned for tonight, but that could change. I'll let you know.
We saw pictures. Okay. Like, what were you doing maybe 30 years ago? What got you involved in all this stuff? Because I know EdLogics has been around for a little bit, but like 20, 30 years ago, what were you doing back then? And how did that lead into what you've been doing with EdLogics since?
Yeah, that's a great question, because my background is really the reason why I'm here running, and we founded EdLogics 12 years ago. But before that, I got a doctor of pharmacy, and I did a couple residencies. So I went to school for 9 years in clinical pharmacy. So I was kind of labeled as a entrepreneurial clinical pharmacist, and I built innovative companies along the way, sold a few of them, retired a couple of times, and came out of retirement. But the reason I came out of retirement to start EdLogics was, as a clinician back in my training and in my early career, I was treating patients in clinics at MCV, Medical College of Virginia, in the inner city, underserved communities. My doctor of pharmacy was in family practice at the Medical University of South Carolina, treating a lot of out islands, a lot of low health literacy. So I realized firsthand that low health literacy was the biggest challenge to getting good outcomes. And I'd give them a pamphlet. It was written at a high level. It went into the trash can. And there was no real effective way to educate these people. But then, 12 years ago, my daughter was kind of graduating from East Carolina University. And she was the person I've been looking for my whole career in building some of these companies. You're always looking for another Tim or another Zach. And I realized that was the person. So I kind of talked to her about, coming on board, and let's go ahead and start EdLogics. At the time, gamification was starting to get hot in corporate America. So we built EdLogics based on gamification and making learning about health, transforming the way people learn about health. But my background was really, I learned firsthand how to get people on the playing field to have an understanding of how to measure their blood sugars, the importance of nutrition, and all the different things that they don't know about. So that was kind of how I got into this, what I'm doing right now.
One of the things that really, it still shocks me when I think about it. I was lucky enough, I went through the civic leadership program a couple of years ago. One of the visits that we had was at EVMC. But one of the things that stood out is that when they said that they can, knowing the zip code that people live in, they can get in. They already know life expectancy is much lower just based on zip code, and that's really sad.
Yeah, as much as 30 years difference. In Boston, from Back Bay to the Commons, you got a 30-year difference in life expectancy. And a lot of people are attributing that to health literacy. It's a death gap, and health literacy is really a big part of why there's such inequities and disparities.
Is there any certain things that stand out in terms of like, what are the, how do you narrow that 30-year gap? Is there certain things that you address first and foremost to start chipping away at that number?
Yeah, so I mean, I think recently there's a lot of quotes going out, but the health of Americans starts with health literacy. That's a powerful quote by Dr. Girard, who is he's an admiral and the former assistant secretary of Health and Human Services. But you're starting to get people recognizing that health of America starts with health literacy. So in those particular zip codes, those people are typically in underserved communities, marginalized communities, but they don't have the understanding. I look at it with 100 people in line. The people at the end of the line are the ones with the lowest health literacy because they don't know how to navigate. They don't know how to, really take advantage of the resources that are available to them, to educate them, to improve their health, to get access to care. So really the foundation of it really is health literacy, which when I started EdLogics 12 years ago, everyone's like, what's health literacy? And now it's recognized as, one of the most critical factors in healthcare. And so chipping away at that death gap of those 30 years really is the different resources that they're not privy to. They don't have availability to it. They don't know how to find it. And it's because of most of those people are health illiterate. Matter of fact, 9 out of 10 U.S. adults have low health literacy, and it's a bigger factor. It's a bigger factor on the health of an individual greater than employment status, income, racial or ethnic group, and their educational level. So those 5 things are not as important to their health as health literacy, and that was the World Health Organization just came out with that.
I remember a few years ago we talked about this probably ad nauseum, Tim, but like I didn't know like macros, like from a food perspective until like 2011, 2012, like really understanding that aspect of it. You got your food pyramid, which who knows if that's where they said you could eat 9 bowls of cereal a day. I think something like that was right. Okay. So it's just interesting to me that like, I think there's a lot of things like this in our world, in our country, that once you know about, it's like, whoa, why aren't we doing a better job of making sure everyone knows about this? Because you would think if people are healthier, that's better for other things. It's just crazy that like I was 38 at the time. That's the first time I knew that like, oh, okay, like this is how many grams of protein you should be eating a day type of thing. Why didn't anyone tell me that? Because that it's just.
And the bigger thing is just the power of the marketing dollars that these companies have to mislead people is really astonishing.
It's sad.
Yeah, you make a good point, Zach, that we tend to think, why don't you know about nutrition? Why don't you know about diabetes or health? It's almost kind of like, well, why don't we know how to program? And why don't we know how to become an engineer? it's really a thing that's almost expected of individuals to live a healthier life, but they don't have that information. And a good example is what you just said. Really smart people out there, but they don't have a clue on good nutrition, initiatives and how to best take care of your body. It's a bit of an educational gap in our country and around the world.
Yeah. Gosh, I don't know. So where did you start? What was the genesis of, it's such a big problem. And at the time you're an early solver for that problem. Where did you start? So where did you start and how did you go about it?
Yeah, no, that's a challenging to start. And I thought that I've started 2 or 3 companies and exited them, and it's not that hard to do another one. But I forgot how much work it takes, and how much you have to dedicate, weekends and nights and all that. I was playing golf at the time, and it's kind of hard to do that at whenever I want anymore. But the first thing was really hiring the right people. I had a great board. In 9 years of schooling, 2 residencies and a doctorate, I met a lot of people, and I was able to pull those people in on my board and then start going out and hiring developers. As you know, computer developers, designers, they rule the world. So you had to have really good developers. So in order to build the EdLogics platform, which is a game-based platform that incorporates behavioral science, personalization, multimedia, and all the pieces, we needed to build a team first. So you have to have creative people, you have to have data analytics expertise, you have to have developers, you have to have the design team and the vision to put something together that's going to work. And I had that firsthand experience on how I thought this platform needed to be built to give the average individual with low health literacy a chance to have better outcomes and better knowledge, and transform the way they think and make it very informative, fun, and entertaining with incentives. So we built that. Incentives is key to this. So financial incentives, there's intrinsic motivation to get healthier, but people like incentives, and they like climbing leaderboards, and they like sound. And it needs to be almost a dopamine stimulating experience to get them to want to learn. And it has to have daily activities, weekly workouts, and monthly challenges so that you can get people on the platform every day. So the first 5 years was really building the team before we ever built the platform. And, in designing this, it was really designed to be around chronic condition management. There's a lot of wellness companies out there. There's thousands of them. The return on investment is a little bit suspect, but health literacy, educating people where most of the money is going, which is chronic disease. 86 cents of every dollar is targeted to chronic disease. And so if we could go into this business strategy with the ability to affect chronic conditions and improve health and reduce healthcare costs for employers. So we started out with employers, started using it in universities out in Ohio, Miami University in Ohio, with their healthy students. But in the back of my mind, or in the forefront of my mind, but I didn't talk about it much, was how can we use this technology to build healthy communities? But you can't raise money. And we had to raise a lot of money to build a team of 21 people that we have right now. You needed to kind of build it in the employer world first, and then take those learnings like we're doing now and build it into the community. And I can talk about that a little bit more, but that's kind of how we started, Tim, is, the vision is first, and there's room to have 10 of us out there. Unfortunately, we're the only ones out there that have built a platform like this, because it's not easy to build. It's very difficult. You have to update content. I didn't mention the content. Content is king, but it's got to be cool, fun, evidence-based, trustworthy content. And that's kind of what makes us different, is our technology is there, our ability to deliver it in fun, engaging ways, video, games, but you got to have good content that's written at a level that everyone understands.
Written for me is what you're saying.
Exactly.
Third grade level. Let's go.
Maybe fourth.
Fourth. Well, are you smarter than a fourth grader? Not a fifth grader. I might be able to get to that level. Who knows? I'm reading this book that Neil Piper of Luminova sent. It's by Peter Attia called Outlive the Science of Art and Longevity. That'll show you that I've actually read some pages, not a lot, but enough. And he's talking about how a lot of stuff is very reactionary in medicine, not being proactive in a lot of it. And it's just, trying to fix those, reacting to that 86% chronic disease instead of trying to fix it beforehand. Right. Like what you're talking about. And so it's just very interesting that, it seems like common sense that that's what we should focus on, is like fixing the problem, like before it starts, rather than just, I don't know, putting some duct tape on it. That's what it kind of seems like we do. And so it's cool to see that you're trying to get behind that and what you guys are doing with EdLogics. Tim is a big habit guy, big tracker guy. And I think he's run like 5 miles every day for 10 years, something like that. And so like, there's a little streak there. And we both do some like brain activity apps, and there's tracking in that. And so it's like, I actually like, it's crazy. I think that one little mechanism, that one little thing that says, yep, you did it, is ridiculously like dumb, but works. And I don't know why, but it's just like I just did my Duolingo a couple minutes ago. I'm on like probably 312 now, Tim. I'm like, cool. If it didn't have that, I probably would have quit after 10 days.
Right.
I've been doing the brain app for a year and a half, almost 2 years now. And so it's like, and you're at like a crazy amount on that too, but it's just that little thing that's like, oh, you need to do that. And then like, there's the run, and then there's like the workout. Oh, make sure you drink your water. Just those little things, that tracking thing. And I know you said you had that with EdLogics. Like, I think I'm sure it's not for everyone, but for crazies like the three of us.
Yeah. No, you have to have levels of accomplishment and achievements, and it just kind of motivates, and climbing leaderboards and competition with your friends and colleagues and family members. So our platform allows us to have challenges within organizations and across communities. People are competing with each other. So it's really, goes back to dopamine, to get someone off the couch and on our app, which is a web app. So it's available on any device that has internet capability, but we bring people in. And what's really cool along this point is, if you can activate them, engage them, engagement is key, because you got to bring them in before you can educate them. So we bring them in with, you guys all know about Wordle, and we built a really cool, much better product than Wordle, we think, called Word Up. And every day you get it's a healthcare word, and you get educated on it. So tremendous amount of education. Yesterday's word was relapse. And so then you learn about relapse in just one single Word Up game. And then we have spin the wheel every day, 3 spins a day. And then we have a digital lottery card every day that asks you a different question. Which of the following is the good cholesterol? And if you get them right, you get points. You climb the leaderboard. You increase your odds of winning cash. And in the employer setting, they put up cash rewards. People are playing for money. And same thing that we're doing in the community here in Healthier 757. But it's those little sparks, those little things that get them motivated.
I want to jump back to the team aspect, because you hit on something that is so not enough people understand the importance of team. What number startup was it, or company that you built, that you realized you've got to set up a team? And we run into so many solo founders that they handcuff themselves because they're like, well, I can't hire a team because I don't have any funding, or they just limit themselves. When did you realize the importance of a team? What advice would you give to founders today that are trying to build a team that they may not have secured funding to build out that team?
Yeah. So building out the team, it was in my previous company. We had 54 employees in 3 locations, down in Research Triangle Park, on the campus at MCV, on the biotech campus, and up in New Jersey, and headquartered right here in Hampton Roads in Chesapeake. But it was 3 different companies, but we had, tremendous people we were able to hire. So you got to hire people that are much smarter than you, is particularly in specific areas, but you need to have that team build out and incentivize them, with equity. If you don't have the ability to pay them the kind of money you need to pay them initially, find people that are willing to take a risk with you and, join in on the mission. If you got the right mission, you can attract the right people. We built this as a virtual company. We have a lot of people in Hampton Roads, and we're adding people regularly and expanding. But the team, you can't build what we've built without having a solid team of people. And, raising capital is critical. You've got to raise that capital to grow that team, to get the right resources in place to design and build your product that starts out as, PowerPoint where, like, this is what's going to happen when you click this button and you go to the next PowerPoint. But you got to take it from that to building requirements and coding so that everything works the right way, which is extremely complicated, which is why I have no problem showing people our platform, because I know that it's going to take them millions of dollars and 5 or 6 years to get to the point where they can really start building the product. But I encourage people to do that, because the more people that are out there, the more it reinforces our vision that health literacy was where it's at. And if you really look at the government shutdown that's going on, they're arguing about healthcare. It's all about subsidies and healthcare and rising premiums. And last night, the CEO of Cigna was on there saying, unless we start preventing chronic conditions, treating chronic conditions correctly, and really focus on what really matters, which is changing consumer behavior, has typically not worked. Education's been really tough to pull off. And we've been able to do that in the way that we've done it because of gamification, of dopamine, and getting people and making content that is at a level they can understand. But it's all about healthcare right now. If we don't solve health literacy, the cost of healthcare, we're going over the cliff. And so that's why we're excited about our platform, and we're excited about making Hampton Roads the leader of the nation, because we are recognized right now around the nation as the leaders in health literacy.
It's amazing. And just to finish that point off about the team, what founders don't realize, it's like getting someone to join your team for equity, as you mentioned, that's like your first hurdle to jump that you can actually sell. If you can sell your vision to someone else to join your team for equity, that's a point. That's a point for the good, But on the flip side, if you go to investors and you're like, yeah, I'm a solo founder, I can't get anyone to join my team. The other thing that investors are hearing is that you have the inability to sell. If you can't sell your vision and your business for someone to join the team, then that's right.
Exactly. Yeah. And actually 757 Angels, we're the second organization that presented with Paul Hirschbiel and David Kaufman. They were my mentors on the training of that. But 757 Angels was really helpful in we've probably raised through 757 Angels directly and indirectly, probably $8 to $10 million. And that's kind of key. You got to know how to convince people to invest in you. And they're not going to invest in you if you don't have a good business plan and people that are on the team. To your point, team is everything, Tim.
Yep.
So there's a technical aspect to this. I think a lot of people, a lot of businesses globally, at least in America, maybe, have challenges with the technical aspect of building a website, an app, and et cetera, et cetera. If you have challenges with that, is that something that's done internally? How have you gotten through with that so that it can actually get to people? Because there's so many people that I know and that Tim knows, and I'm sure you do too, Tom, that's like, I have this great idea, spend a couple $100 grand to get it off the ground, a couple million to get it, and it sucks. It ain't doing anything. Like, how have you solved those technical challenges and gotten it done where so many struggle with that?
So the key is, as I mentioned, developers rule the world. You got to have great developers, because I'm very engaged on what I want this platform to do, that I want to include, spin the wheel, daily spins. To make that happen, you have to have really good business analysts that can create very specific requirements that coders can build. And so our coders, the key is we've been able to keep our team of 21 people. Most of those have been here from the very beginning, and they've stayed. I mean, everyone's trying to poach, your developers, but we do it all in-house in the US, not in-house. We're virtual. So we're able to steal someone out of Disney in Orlando, and they live in Orlando. So our people, we have stand-up meetings 9 o'clock every day for the last 12 years of all of our developers and designers and analysts. And we've been able to have a remote workforce, somewhat hybrid because we're here as well, but we've been able to pull the right people together, and we share what they're doing with our business team that's out in the field selling and creating relationships. And so we involve them on the business side, and they involve us on what they're doing. They're able to brag about the cool features that they're building. We're building a new certification around fentanyl safety right now. Building a certification course might sound relatively easy, but it affects every part of the platform. It has a curriculum and stuff. So we're always coming up with new stuff, Zach, that the challenges that we give these developers, because they look at it like a challenge. How do we make this thing happen? And how do we design it fast? Because we have clients all over the country that want us to add a new capability to increase awareness of their benefits. And that's kind of a cool thing, is that our platform has evolved from a health literacy education platform to now an engagement platform, a digital front door to an organization. And then we'll teach them about telemedicine, and then give them points and incentivize them to sign up for Teladoc or go sign up for their diabetes case management. So we are actually the front door to an organization's entire group of benefits. And we drive awareness and utilization and sign up of all their benefits, which they're spending a lot of money on benefits, but if people don't know about it or use it, they don't get a return. So we've been able to kind of come up with real creative requirements that these developers are excited about and take it on as a challenge.
I would think, just for clarity on my sake, I would think fentanyl safety, you're probably talking about prescribed fentanyl. I would think that there is no such thing as a safe way for fentanyl.
We're talking about, so our platform started out with chronic conditions, went to common medical conditions, then it went to cancer. So we have a whole cancer hub. Then it went to navigating the healthcare system. Then it went to safety. So we've been adding these categories. We have over 100 topics, but essentially anything that affects an individual's life that happens to be an administrative assistant at Town Bank who buys our platform. So Centera buys our platform as an employee health benefit. They've been on it for like 4 years. Town Bank's been on it 9 years. So Bob Aston at Town Bank wants all of his employees and their families, because they're responsible for every bad decision that costs their healthcare spend. The smarter they are, but indirect medical costs are as costly as the direct healthcare costs. Absenteeism and presenteeism. They're there, but they're thinking about their daughter who is dealing with social media anxiety or is depressed. They're at work, but they're not thinking about work. They're thinking about what's going on in their family's world. So we now are really talking about, and that fentanyl is, one bad decision by a 14-year-old up in his bedroom who gets, a delivery of an ADHD drug or a Ritalin that's laced with fentanyl. That's the last decision they make. So we educate them on all of those things, the emojis that are being used by drug dealers to get into the home of your kid, and you have no idea. They think it's a pizza being delivered, but it's fentanyl that's laced. And so we teach people about, how to talk to an individual that may be contemplating suicide. If you were approached, you may not know really what to say or not to say. We teach people how to deal with day-to-day issues that are affecting their life. So it's much bigger than chronic conditions now. It's about if we can make people more productive at work. And we think that and we're working with the Hampton Roads Workforce Council, health literacy should be involved in every workforce development program at TCC and other universities. So it should be part of the curriculum, because a good welder for the shipyard is not as good as a good health literate welder that's going to be showing up and more productive and less costly. So health literacy fits into economic development in a big way. And now companies are looking at heat maps where Northern Virginia, where Amazon relocated, that's pretty good high health literacy. It's green. We got parts of our region that are red and yellow. People are looking at heat zones to see where they want to go, because they don't want to hire an unhealthy, low health literacy population. So economic development, people choose their locations based on health literacy. And it's pretty cool stuff.
Is that a difficult sell? And I feel like in the conversation, people will be like, yes, get it. But then to actually get it executed and into their portfolio, like, is that into their companies? Like, is that a difficult sell to get to happen?
It was really hard at first, because people are going, well, I got my benefits. I really don't understand what health literacy has to do with it. Now we've reached I was, and Shannon Pierce, the CEO of Virginia Natural Gas at the State of the Region. 30 minutes after we left that thing, she sent me an email to introduce me to her HR and to her philanthropy person, her consumer and community engagement person. So it's changed to people calling and asking about how we can get together and talk about integrating our technology as an employee health benefit. But more importantly, as you know, I've been at this for a while, and we launched Healthier 757 about 6 years ago, just before the pandemic. And I have to sell this thing, and you can't be a slick salesman. I'm a clinician. Not many people know my background, but you got to slow walk it. You got to take years to get people to understand. And we've reached that tipping point where we're now partnering with Anthony Walters at the YMCA of Hampton Roads. We got the food bank partnering with us. We have junior achievements. We got press releases, probably 7 press releases going out over the next 7 weeks with all of these partnerships with Hampton Roads Workforce Council. So they're calling and saying, how can we become part of your mission to get it into the schools? Norfolk Academy, we believe that health literacy has to start in K through 12, and using teachers to deliver that information. Because if we can get young kids, to your point about nutrition, Zach, if we can get young kids to understand good nutrition, good healthy habits, washing their hands, brushing their teeth, we can kind of change the dynamics of families and our region. And if I could add one more comment on that, is Healthier 757, with all these partnerships that we have, we're being recognized in federal grants and statewide grants to implement our technology throughout the Virginia region in rural health transformation, a $50 billion grant that's going out to every state. But we're hoping to be a critical part of that, because we have the connectivity through this technology to pull all the pieces together. So it's not disparate health fairs here and little, different information. So companies like Bon Secours and universities are realizing that our technology is a needed requirement for them to deliver educational content in this new world that involves digital and incentives. And they don't have the ability to build it, so they can use ours, and we partner with them. And ultimately, our goal is, and we're not far from it, but every month we will have throughout Hampton Roads, in all of the jurisdictions that we have, we'll do diabetes, we'll do opioid use, we'll do breast health, we'll do different topics, and everyone will be seeing on TV, on radio, on digital signs in restaurants, and all the other ways that we are marketing it on social media. You guys will be promoting that we're right in the middle of Diabetes Month. But that would be so cool. And we are the national spotlight for doing something like that. It's impossible to do without this technology and without the partners, the food banks, and everyone getting to every consumer. So they're putting our cards in 7,000 backpacks a day through Chris Tan and the food bank to get those backpacks from the kids in school to the parents.
Well,
So
one of the things that
Who's
one of the things
calling?
would be
Anyone good?
that was
Anyone
my
good?
daughter, Brooke, who is the
T-
chief product
You
officer.
know, tell Brooke she needs to be watching the show. Come on, Brooke. Like, let's go.
She's actually driving up here. She's off today because she's coming to the event tonight. So you'll see
Wow.
my daughter, Brooke, who I
All right.
call the brains of the operation. She's the one that makes it happen.
All right, Brooke. We'll give you a little pass this time.
Yeah. I'm just thinking how great would it be for you and EdLogics if like somebody goes to the doctor, they've just been diagnosed with X, Y, or Z, and then the doctor prescribes your platform to learn about the condition that they were just diagnosed with. Like,
So funny you should say, because yesterday I was at Jones Family Practice in Virginia Beach. Nurse practitioners, physician assistant, Thomas Jones, the owner. He walks in and we were there. We brought breakfast. It was 7:30. I felt like a pharmaceutical sales rep because reps go in and talk to the doctors about their drugs. We went in to talk about this free platform called Rewards for Healthy Living, which is part of Healthier 757, which is the initiative. But consumers get access to the same platform that Town Bank buys in Centera and Port of Virginia and Chesapeake Regional and All First. They buy that platform, but we now make it available to everyone in Hampton Roads for free. But what you just said is it's really the second physician practice that we went to. And so they're all in and they have an actual prescription pad. It's a InfoRx, a health education prescription. So they actually check off diabetes or vaccinations or weight management and nutrition. There's 100 topics on the prescription pad. And so they actually give it to their patients. We have our marketing material in the waiting rooms in the acrylic stands. And so the nurse practitioners who I happen to go there, and she said, you should come in and tell all of our doctors and nurses that they should use this and prescribe it. Because in a new world of pay for performance, doctors get reimbursed based on outcomes. And so more and more, it's no longer about how many tests they order. It's about what are they doing to improve outcomes and closing gaps in care. That's a big issue. We help those physicians close gaps in care because the consumer is engaged in their care and they know how to interact with the physician. And when I was showing them the platform, this is Health Literacy Month. And when you click on that, it says how to talk with your doctor. So that was pretty good timing. I showed the doctors, this is what we're teaching your patients is how to interact with you. So we want to be in every, Tim, to your point, Jones Family Practice is a lab for us. We have a lot of laboratory things that we've been doing, and we're taking those models and they've already been advanced across the region. HR CAP, for example, is taking all of our stuff in their 20 locations and going from K to the seniors. And everything they do, they're promoting rewards for healthy living. But I'm really excited about having physicians, clinics, Centera Healthcare, Bon Secours, everyone prescribing it. And Bon Secours is using us to drive people into their breast mammography screening clinics using our platform. And we're on there, our platform is being shown on the digital screens in the waiting rooms.
Very
wow.
cool. I've heard this word being used before, the word access, ACCESS, that access is the most lacking thing that this region has, that the 757 has. It does not sound like you would believe that statement. And if not, or you do, what is missing from that perspective? Like, have people been open to you in that perspective? And if access hasn't been an issue, what has been kind of the biggest struggle or the hardest thing to try to get ahead of from the region perspective?
So access to organizations.
In general, just access to anything.
Yeah. So I think we do a really good job collaborating and for the most part, but we could do better. And we're gonna be successful as a region together and not individually. And so I think we've been in going out there and trying to get this out there. it's kind of people like, what's Tom's deal? What's he trying to pull off? And what I'm trying to pull off is improve the health of this region. And so having everyone collaborating and liking posts on social media, simple things, or driving awareness of their members. Blair Durham, at Black Brand is a key partner of ours, pushing it out in the community. So access, a lot of it is on, the lack of knowledge and awareness of what's available. And that's kind of across the board, not just us, but we think we can improve what's going on at -9 to 5 with childcare services, is educating our users, thousands of users on the platform every day, about what's available to them. There's access to all kinds of great programs. They just don't know about it. And we can link them to it and incentivize them to go learn about some of those programs. But so access is a big kind of nebulous in a way. There's access to the resources in the community. There's access to the right key decision makers. And I'm really pleased that it was hard at first to get everyone to see this. And we're raising money through the Birdsong Health Literacy Center of Excellence. George Birdsong is an amazing man who's really been behind all of this. But we power the Birdsong Health Literacy Center of Excellence, which raises money from Town Bank and Centera and philanthropists to make this platform available to the community for free, because it has to be free. Tom Jones, Dr. Jones said, what's the catch? How much does this cost? What are you going to use the data for? Are they going to get bombarded with other websites? And the answer is no to all of that. It's free. But so access is a function of availability for free to the consumer, but access to the right partners is really starting to take off. And I think all of us are rowing in the same direction. Does that answer your question, Zach?
Yeah. I mean, well, you seem like you're fairly persistent. You don't seem like the guy that would, once you hear no the first time, or I have to reschedule my meeting, that something tells me that you would follow up until you get that time with the person that you need to talk to.
It's funny you say that, because when we launched this at Old Dominion University, we had Austin Aghow, who was filling in for John Broderick, who was opening the event. We had about 18 speakers. I had Tommy Thompson in, who's chairman emeritus of our board. But they introduced me as the man who doesn't take no for an answer. And I thought that was kind of cool. And then Nancy Gurdon, who was moderating the program, reiterated. So now, without further ado, let me introduce Tom Chamberlain, the man who doesn't take no for an answer. But you have to be persistent. But we're not selling anything. We're giving it away, And so I sometimes feel I'm handing cards out. I'm handing cards out to people that I think we can make their life better, live a longer, a happier, and a healthier life. And I tell them to share it with their kids, share it with their siblings, share it with their parents. Elderly people, loneliness is one of the biggest determinants of poor health outcomes. And we got people that are in their 80s playing games, competing, winning money on this platform. So it's really cool. And then sitting is the new cancer. So you got to get off the couch and you got to engage. And we try to really motivate people to get active.
One thing that I hope that I can explain this right, but one thing, I listened to a podcast with Mark Cuban a couple of weeks ago, and they had asked him what the biggest challenge was within the healthcare system. And what he had said was the biggest problem that he sees is that people that don't earn enough money, therefore then elect from a health insurance standpoint to pick the policy with the highest deductible. And because they have the highest deductible, then they can never go see the doctor to have the treatments needed because they can never pay the deductible. And so I see with what you're doing here with EdLogics, is it is that ounce of prevention being the pound of cure, so that you don't even have to be in the situation that you're worrying about meeting deductibles or being able to have the affordability to meet those deductibles.
Yeah, it really is, educating them so that they don't need to seek care. And with the shortage and crisis that we're in across the nation and here in Hampton Roads, is shortage of nurses, healthcare professionals, techs. And I know that the workforce Hampton Roads Workforce Council is really working to address and get people into healthcare and trained. But people really need to take advantage of this educational. And as I said, education has never worked. That's why when you go to national conferences, everything they talk about is how they're going to change the supply side of healthcare. It's physician networks, incentivizing doctors, building new technology. No one ever talks about the demand side at the consumer because it's never really worked. And when I talk to those speakers, I grab them as soon as they're off stage in Philadelphia and say, we can affect outcomes by affecting the demand side, by improving the knowledge of the people you're trying to change behaviors. And behavior change doesn't happen at the doctor's office. 90% of behavior change is at the home in their own time. So they're in there for an hour, if they're lucky, more like 20 minutes. And then they have to rely on, knowledge and information to make the changes that they've been prescribed or recommended. But more importantly, keep them from needing healthcare. And self-management is more important than it's ever been, because you can't even get a doctor's appointment these days without waiting 3 months. So I think the dynamics of the healthcare system, what's going on in Washington, is just furthering the need for advancing consumer education. And they don't say the words health literacy yet, but they're all around it, of how do we prevent and better manage chronic disease where the money is.
How much sleep do you get at night? You seem pretty high energy.
Well,
have you always been high energy?
I have. I mean, I'm fortunate that I can get by on minimal sleep, but sleep health is one of the number one things on our platform. Addiction is number one in employers and in the community with thousands. We have 41,000 users. Sleep health is right up there, particularly at Norfolk State University and Virginia Wesleyan, who uses our platform. Sleep health is really important to the administrators, and they're driving, people to that because, it's more than just sexually transmitted diseases, which is hot, and, addiction, but sleep health is really important. But I'm aware that sleep is when your brain recovers. So I sleep more now than I used to. But I'm basically nights and weekends. I work with George Birdsong every night. And he's 85 years old, goes to work every day in Suffolk to run Birdsong Peanuts. And we get together from 7 to 11 every night and virtually every Saturday and every Sunday, because he's invested into building a healthier Hampton Roads. And we're actually looking to go to healthier RVA in Richmond and replicate. We're building the model in Hampton Roads through the Birdsong Health Literacy Center of Excellence and its philanthropic support. We're powering it with our technology and our manpower, but Birdsong is hiring people to partner with all of the people in Hampton Roads to give access to those, particularly those marginalized individuals. We have to get the people that are underserved. But whether you're at the north end of Virginia Beach and doing just fine, most of those people are low health literacy, and it's for everyone. But sleep, I used to say it's overrated, but I don't think that's true.
Well, I would be embarrassed to know what my literacy was. Is there a baseline test that you can take at the very beginning to find out where you're at?
Yeah, we do. We actually have a lot of baseline knowledge around health literacy and numeracy. Health numeracy, numeracy is critical. How do you calculate your insulin dose? I mean, just take, I use the administrative assistant at Town Bank who has a newly diagnosed 12-year-old diabetic. That's a major problem. And there's not really good information. Our platform, our diabetes platform, is second to none. I think our platform is much better than people get at discharge from a hospital system. But, you really have to, get that information in their hands. But it's rewarding that our testimonials are huge. People are unsolicited testimonials talking about how we changed their, the trajectory of their family's health, and with real specific examples, getting their husbands, the women kind of rule the healthcare of the family. And so they're the key people to get us guys to open up the men's health and learn about prostate health and learn about the need to get your colonoscopy. So, or medications. If you're put on a medication, you just type in M for metformin, and you got a virtual pharmacist telling you everything you need to know about metformin for diabetes. It's right there on the platform, right at their fingertips. And we're building AI so that your platform is different than your wife, Tim, because she's a female that has interest in, breast cancer. We want prostate health. So everyone's platform, based on the onboarding and the attributes that I'm interested in, everyone has a different platform, and every company has a different platform because each company has different needs. So we're able to scale nationally, and in hundreds of companies. Right now, we don't have hundreds, but we can scale custom platforms at scale, which is pretty cool. It can have a different look, a different feel, different logos, and different content. We can shut content off and add new content for Town Bank. It's pretty cool.
Love it. That is very cool.
And what's something we haven't talked about that you want to talk about?
I guess certification is really important. If we can certify people, and it's kind of a curriculum. So our platform was built for adults, right? And I went into Nansman Suffolk Academy, and Debbie Russell was going. I said, well, it's not really built for kids. And she goes, but it is. You have asthma, you have diabetes. My people have issues with depression, with suicide, with mental health, and listed 12 topics. And I said, I guess you're right. So we use this platform in the youth, and it's available for anyone 13 and up, so middle schoolers. But we think that getting into the school systems, using the child not to be on the platform, but to bring the information home to mom and dad so that they can start managing their family's health and dealing with social media challenges, or, how do you protect yourself in a crowd? Have the right kind of colorful clothing, make sure phones are up and, powered. Where's your meeting point? What's your code words? All that stuff. But if we can certify individuals to understand diabetes and have it funded with specific incentives and rewards, you could save $100 million for a state by educating people to make the right moves and prevent going from pre-diabetes to diabetes. Half the people out there have pre-diabetes. They don't know it, but they can understand it once they learn, and they can make simple changes to get normal blood sugars. But certification is really a curriculum. So we're bringing this to the low health literacy. So someone who never finished 8th grade, they might have a harder time navigating our platform, but we have diabetes for beginners, and they click it and it takes them through like a teacher would, from, what is the disease? How do you measure your blood sugars? How does nutrition affect it? So simple curriculums that they can go through. And once they get comfortable learning, then they can go and self-navigate around the platform. But those are all exciting things that we're building right now. And, I think the model that we're building, the other thing is, during COVID, we were hit hard. We could have easily gone under, right? And just like a lot of companies did. So we built this, and my investors want to see, we built this thing to exit with the right partner. And, that right partner is someone who has the same vision to build healthy communities. And there's some great organizations, large companies that would benefit from having a capability like this. But, it takes longer than you ever thought it would. So it always takes more money and more time. And then we were hit with a lot of issues around COVID. For 4 years, we're trying to build a healthy community during COVID. We had students from Norfolk Academy and the public schools on our Healthier 757 student ambassador program, but no one could go out. So at the libraries, we were giving away bookmarks on the drive-through during COVID. And so being persistent and being able to get creative, and we put all of there was no company. We lost General Electric, GE Aviation, GE Aviation. There were no planes going. There were no mechanics on the runways during COVID. So we lost that account. We lost another one, but we kept our others, but we shifted all into the community during COVID, which was a great move because it accelerated my vision of building healthy communities. Because if you can build healthy communities and get the funding that's needed, you can be all. So we own URLs, healthycharlotte.org, raleigh.org. When Town Bank bought Greenville, we own healthiergreenville.org, .net, .info, and .com. And so we have different URLs. We're implementing Healthier 450 in Ohio. We're actually working with a federally qualified health center. So they're taking our learnings of Hampton Roads and we're replicating them right outside of Cincinnati. And 450 is the zip code, the first 3 letters of the zip code. And so we're already being asked to replicate what we're doing, but we don't want to get too far ahead of ourselves. We got a lot of work to do in Hampton Roads to really make that happen.
Let's go.
Your support and, what you do on social media, increasing and all. If we can get everyone doing that, we can reach so many people, particularly with geo-targeting and personalized algorithms that can reach those people with the right message that's going to resonate to get them to sign up. So
I appreciate all that you are doing and the passion that you have, and you get it.
Yeah.
So thank you for that.
Thank you. Yeah. And I think the philanthropists, they're investing in, like George says, it's great to invest into a building, and a new clinic and a new hospital. Why don't we put some of that money into prevention and educate people to keep them out of those clinics? And, so I think the philanthropists are really starting to realize that to make Hampton Roads is unique in that we own it. The people here are so into this region that these philanthropists that we have, the big ones, Jane Batten and Joan Brock and George Birdsong and many others, but they really are passionate to help build EVMS and ODU. And, and I think we're starting to get people seeing that what we're doing is impacting all of the other things that they're supporting. So the more we can get that, the better.
Well, when you're, I agree. And when you're working late, maybe before your 7 to 11 with George, you want to grab a bite to eat. Where is the place that Tom likes to go? Or if you're whining and dining somebody, where's the place to go to represent
Il Giardino's. I mean, Il Giardino's has been my sister died of brain cancer, but that was her favorite place. And Il Giardino's is awesome. Aldo's is great. Coastal Grill. There's so many great restaurants here, not just Virginia Beach, but down in Norfolk. And so I'm open to all new places too.
Well, that's what we ask, because we're trying to determine if there's a food or a beverage of the region, but then also we like to learn about new places as well, so that Zach and I can shortlist some places to explore.
Well, we need to go out, and at least I'm going to be with Charlie O'Brien on Friday tomorrow.
Oh boy.
Yeah.
The real one or the robot one?
Yeah. Actually, he said, we're going to go to happy hour and you're going to buy the first round.
That's how he gets you.
But yeah, he's a good innovator. And we got some great people doing great things. And these startups seem to be taking off. It's not easy to build a company, as you guys know. And, and the more persistent, you got to be persistent. You got to keep going, and you got to get the right people on your team, like you asked. And but if you got the right vision and you can help people, we think we're in the hottest space in healthcare. And we look at Sean Avery, workforce development is real hot, and health literacy is real hot. We can go after federal grants together and get more funding into Hampton Roads by adding health literacy to these other types of initiatives, because they all tie in.
Well, it seems like in the course of this hour, I think you've named everyone on the power list. So you've certainly associated yourselves around all the right decision makers in the region to make this happen.
Yeah, no, we're really fortunate. We had that luncheon not too long ago, and we had about 106 people, and it was all the key leaders that came because of George Birdsong. But it was great to have key leaders behind this. And some of the people I named, we're not necessarily getting funding from them.
Right.
But, it takes a while. It takes 5 or 6 years to get someone to put money up, and it's got to be slow walked.
Well,
different pieces to the puzzle. Not
That's
everyone's
right.
going to be the one writing a check. Maybe they're the person that's going to introduce you to the right person who can help elevate it to the next thing. And so,
playing chess.
Exciting to see.
Yes.
Well, we're a couple hours away to find out if you're going to take home the gold, the big championship belt. Are there
Yeah.
any 9 title belts tonight, Tim? That would be fantastic. I hope that's what you.
I would tell people if you don't have a ticket to make sure you get a ticket, but we're out of tickets. So
Oh, that sucks.
I heard that Paul Hirschfield told me today. I put out a thing last night. You can get tickets here, and he said no, it's at the door. But that might not be the case either, right? They're sold out.
It will be interesting.
Yes. Well, we got tickets for a big team of people, our investors.
Someone's going to be sitting on my lap. That's all I know. I don't know. Like Tim, you can sit on my lap. I don't.
It will be interesting. Dude, it's so awesome that we're, in my mind, we're the hottest ticket in town. Back-to-back events. So we just got to, much like you're building your community. We're building ours. So super excited for tonight. I'm excited for you and wish you the very best of luck tonight to bring it home.
Thanks. It's one thing and many things in the future that we'll be doing together. And, we need to be partnering with people like you that are accelerators. And the startups are really, indebted to you for a lot of what you've been able to do to expose them. And, you've exposed us through the Startup World Cup, through this interview here, and which I've really enjoyed, and hopefully shared some good stuff that, will help people understand our mission. But I can't thank George enough, George Birdsong. He's a real Virginia gentleman and has done wonders for this region. And now he's known as much for health as he is for peanuts. And,
and that's this is a conversation for another time, but we were told that this is the Napa Valley of peanuts.
Oh,
it is. Yes. Yeah. Thanks to George and his family that has been around forever. So
nothing like a good handful of nuts, just pop them all in there. Let's go.
I keep saying, George, this isn't peanuts. This is big.
Tom, it's been a pleasure. Looking forward to seeing you tonight.
Thank you. You guys are great. I enjoyed it, and look forward to seeing you tonight and doing great things together.
Absolutely.
Awesome. Thanks, Tom.
Peace.
Have a good one. Appreciate it.